welcome to the Public Health Minute. I'm your host, Nola Aigner Davis. It has been a crazy year for everyone in public health as they are dealing with the pandemic, the COVID-19 pandemic. Today's guest is Helen Eddy, Director of Polk County Health Department. Thank you, Helen, for joining us today.
Well, thank you, Nola. I'm happy to be here.
Great, so let's get into this. We've got a lot of great questions to ask. So first of all, when you heard the word coronavirus, COVID-19, what was your initial reaction?
My initial reaction was, what the heck was that? And what is it? And, we started hearing a little bit about this little virus that was over in China and started paying a little bit of attention to it. But, we've had several, what I would call close calls in recent years where you hear about a virus that's kind of percolating and, nothing much comes of it. So I suppose we kind of hoped that maybe it was, again, going to just kind of be nothing and nothing to be of concern. But that changed pretty quickly.
Yeah, that definitely changed pretty quickly for you and your team. So how did you gather your team and start preparing for the virus? What did these initial steps look like?
Well, we actually started, we're recording this on January 15th, and it's really almost exactly 1 year ago that we initially pulled together a team, and it was a small group. It included just a handful of us from the health department and Polk County Emergency Management, just to have some conversations to kind of set the groundwork for what we thought we were potentially seeing, hearing. We got on the whiteboard in public health. We love whiteboards and we scribble all over those and started making some lists of ideas of maybe some things that we could and should look at. I do want to say that one of the things that we had available to us was, a pandemic response tool and guide that the Polk County Health Department had put together after the H1N1 pandemic. And so we had some experience. It turned out to be not a pandemic quite like this one in terms of duration and all that, but it gave us a great starting point. So we pulled that out, took a look at it, and started digging into that and trying to see what were some steps maybe that we needed to. We like the term here in public health and emergency management of leaning forward. How could we lean forward and start to be ahead of this? And so we started meeting weekly, and then weekly became twice weekly pretty quickly. So we've been at this for a year.
We definitely have been at this for a year. Thinking about the steps in the year, were there any milestones that really stand out to you so far in this year or the initial phase of this?
Yeah, there are a few dates that are kind of burned into my memory. March 6th was the day that we decided to actually formally activate our Emergency Operations Center. So in emergency management, as I have learned, there's kind of a formal process of what you do and when you activate and do that. We knew that the following week that the state was going to activate the statewide Emergency Operations Center called SEOC. And so we activated ours on a Friday, and they activated theirs on Monday the 9th, and we started rolling. And I also recall in that first week, we very quickly activated what we called our Medical Coordination Center. So, I think the 9th there was an activation. By the 11th, we had brought that team in. That team included, actually, the first meeting, it was the chief medical officers from all of the major health systems, plus primary health care and the Iowa Clinic. And we brought them together to tell them what we were seeing, what we thought we were facing, how we wanted to bring them together as a group, because we knew that coordination with our hospital systems was going to be critical. We had to set aside being competitors and work together, because we were starting to see by that point what was happening to the hospitals in Wuhan, China, and we needed to be ahead of that. We asked them to dedicate a decision maker from their organization that could come to the Emergency Operations Center daily and meet, and it had to be someone that could make a decision. And we couldn't have a process of, oh, I've got to go back and talk to somebody about that. It had to be somebody that was trusted and high enough up in the organization. So we brought them together for a meeting. They said, yes, we get it, we're in. And the next day they sent their representatives. I may have misled them. I mean, you think about the scope of this, they're like, well, how big of a commitment is this going to be? And I said, 40 hours a week, maybe for 2 or 3 weeks. And it ended up being for about 6 months. And we're still talking multiple times a week and daily. They're not physically there, but they came to the health department every day for 8-9 hours for a long period of time. But so that's kind of like all in the first week. We had our first press conference, I think, on March 16th.
Because what happened March 14th was the first case of community spread in Dallas County. And I think that's what initiated everything for the organization.
Yeah, and then I think our first case was actually the 15th, Sunday the 15th, we had ours. And actually I was really, you're kind of sitting there waiting for that shoe to drop. And what is that going to mean when it actually is in your county? It had probably been here for a while, we just didn't know it. But you kind of wait and you kind of go, I mean, truthfully, you're like, well, I'm glad we weren't the first. So, and it came on a Sunday. So it kind of took I'd say maybe for you, Nola, it took a little heat off as the communications officer, because you didn't have to, it wasn't new. You didn't have to answer all those questions about the first case in Iowa. It was like, it's here. So we had our first press conference, and I think if anybody listened to that first press conference, they probably heard me say 211 about 50 times, because
that would be correct.
Because one of the things we really wanted to do was make sure that we had an easy way for our community to get basic information about the COVID-19 virus at that point. And so we partnered with our friends at United Way and activated 211. And one of the things that we did, and Nola, maybe you can speak to this, we're pretty instrumental in, is that we worked to embed healthcare professionals, nurses, inside 211. Do you want to talk about that process a little bit?
Yeah, absolutely. So we were really lucky to have healthcare professionals. We had school nurses who weren't working at this time devote some of their time, dedicate their time to answer the phone. So we had nurses from our schools, we had nurses from our healthcare systems. We actually had DMU professional students in healthcare fields answering calls. And what this really gave is not a general perspective of just the overall virus, but they actually had someone who had the medical knowledge of this virus able to answer their calls and direct them. And I think that was a really important step that we did, because it helped to alleviate a lot of calls and a lot of concerns on our health system, because we know that our healthcare systems and partners were really inundated with calls, and this took off the heat and centralized that call center. So it was a really great partnership. And within the Medical Coordination Center and myself, we really looked to see what some of the questions were that were going out in the community. And then we figured out how to disperse the messages to the public about exactly some of the challenges that were being faced with those 211 medical triage call centers, the nurses and the medical staff were taking. And so we kind of went from there. So it was a really great way to really hone in on a certain location for people to receive calls, but also the messages and the information that our community was not getting, and then we could disperse that to our community.
Yeah, that was, I list that as one of our big wins and things that we've learned. And as we looked, I did what I call kind of a halftime pause on the pandemic, and we did some disaster recovery, which is kind of a strange term because we were still in the pandemic and the disaster. But we brought together community leaders and we had a health committee. And I think overwhelmingly, all the committees identified that using a centralized place like 211 for our community for all kinds of concerns is a great thing. And so we're going to see some strengthening of that 211 system as one of the great things that, you know, there's always something good that comes out of a pandemic or any kind of crisis. And for us, I think one of those things is going to be the strengthening of 211 as a community tool.
Absolutely. So March 14th happened, got the ground rolling. We started seeing cases in Polk County. What now? Where did the direction of your team go? What did you do from there?
Well, I would say early on, I mean, we have a team of professionals here at the Polk County Health Department called the Communicable Disease Team, CD team for short. And those are seasoned public health nurse professionals that are tasked every day with doing investigations and case investigations of all infectious diseases and reportable diseases that are in Polk County. Most of the time it's, salmonella, food poisoning, it's, measles, if we would have a measles scare, hepatitis B,
You were very active in the Ebola outbreak that we saw in the United States.
Yeah, Ebola outbreak. And they started in with the case investigations for the COVID-19 and really doing what those terms that I think none of our community understood at that point, but contact tracing, the process is to grab a hold of that infected patient, talk to them in depth, get them to think through who had they all been around in the previous 14 days. I don't know about you, that's hard for me to be accurate on, where have I been, who have I been around, and then really to coach them on what that quarantine and isolation guidance is. Isolation for them is a positive, quarantine for those people that they come in contact with. And that quickly became, a 24/7 almost kind of operation, and really became overwhelming. I mean, we were bringing in extra help and things. And when we started seeing some outbreaks in neighboring counties in their meat packing facilities, many of those residents live in Polk but would commute to those other communities. And that was when we had to turn our contact tracing over to the state of Iowa. But that was one thing that, kind of exploded pretty quickly.
Yes, correct. It did explode quite quickly. So the pandemic in Polk County has many ebbs and flows. What did your staff do in times where the cases and deaths were maybe not surging? How did they lean forward in a sense?
Well, I mean, I think you're always looking for what are those next messages. You were involved in that. What's that education that we have to do? Are there groups that we need to reach out to with different types of messaging? We have put together plans for lots of things that we've never had to use, thank goodness. In your downtime, and I hate to say downtime, that isn't really true, but you take the advantage of, okay, in that next surge, if our hospital system should become overwhelmed, do we have a plan for how we're going to cross-set and level patients across health systems? In other words, do we send people from place to place so that they can get the care that they need? So one hospital in our system is not overwhelmed. That's part of that medical coordination center and that communication. Do we start putting together plans for what an alternate care site could look like? Who might go there? What does that potentially look like? Again, so that we aren't in a crisis situation and then saying, oh no, now what do we do? Those things sometimes take, a month to stand up. So we have to have the basic plan of exactly what it is we're going to do. We had lots of communication about proactive things like testing protocols, so that we were uniform here in our community about who the clinics were testing, how we were doing that, visitor policies. And so lots of little pieces of a very, very big machine that we have to look forward to. We started planning for vaccinations at the end of the summer, and vaccines didn't arrive until almost the end of December. So that's an example of that leaning forward, looking forward. How are we going to do this? So now that when we have vaccines, we have a solid plan. We're ready to deliver vaccines. We're just waiting on the supply to increase.
So in times of surge, what did your staff do differently? How did you prepare or react differently to the surge?
Well, you have to, again, kind of look ahead to see what you're seeing. And we've had to pivot. I said I've been playing a chess game with staff here at the health department. We have 42 very wonderful, dedicated employees. and they're sometimes doing things that are not their job. I've taken people from my lead remediation team, and they were helping in the food pantry and delivering food boxes to families in need that were in quarantine. I mean, I looked like I had a diaper warehouse for a while in the back, but we take care of the people in need. And everybody in this team stood up and did what was needed. We had to hire extra help. We had to hire some extra part-time nurses to support that CD team that was doing some disease investigation. We could never, after April, do all of our own disease investigation, but we chose as a health department to focus on our schools and families. And so we have added some extra help so that we're working with those school nurses to provide them with the support that they need, because that has become a challenge as kiddos have gone back to school. So it's a big chess game. And this was all until we got to the end of December, really without any funding. So trying to figure out how to do it inside your current budget and still make sure that we were protecting and keeping the residents of Polk County safe. And I'm really, really, really proud of the work our team has done.
Awesome. All right. Tell us about the work in the community. How did community partnerships help during the pandemic?
Well, in something as wide-reaching as a pandemic, you can't do it with 42 people in a health department. I mean, it's impossible to do this kind of work without community partners. I've touched on the MCC. They have been a partner by our side the whole way. United Way, 211, our schools, our school nurses, our board of supervisors have been extremely supportive. Business community, it has really been a full community response, I guess is the right word for it. But Nola, I would like you to touch on something that's near and dear to your heart, which is really the work that we've done with our community partners in our refugee and immigrant communities. One of the things that we know from this COVID pandemic is that population has really been disproportionately affected. And you have done a lot of work, tremendous work previously, and some really good things to come out of that. So could you talk about that a little bit?
Absolutely. So we know that our refugee and immigrant population is a population that needs a lot of information about the vaccine and about the virus. So one of the things that we really tapped into is our work with ROSI, Refugee Alliance of Central Iowa. I serve as the health chair the chair of the health subcommittee. And so one of the biggest things that we did was really work with ROSI to make sure information was spread to the community. What we did was have community conversations. And those conversations would consist of maybe calls on weekends, calls on nights, working with our ethnic community-based organizations one-on-one to hear the concerns and issues that they had around the virus and how in Polk County we could help. So I think that was the biggest thing, is letting that our ethnic community-based organizations know that we are here for them and that we can help them and provide them any information that they had. One of the neat things that Rossi was able to do with the partnership of Lutheran Services of Iowa was to open a hotline, and they were able to support over 10 different languages that are spoken here in Central Iowa and have someone be able to answer COVID-19 calls. And we'd work with Rossi to make sure that they would have the right information and up to date on the most current information. So that's just one of the things that we did. And now something really cool down the pike that we're really excited about is we have received a grant from our partners at Mid-Iowa Health Foundation and Des Moines Community Foundation Disaster Relief. And what we're going to be doing is a Train the Trainer program. So we know that our leaders in their ethnic community-based organizations often dedicate a lot of their time freely to educate their community about various topics, and specifically health topics. So we are able with this grant is to train them and provide them monetary compensation for all the hard work they do. And so we're really excited about this. Each program will be a little different because our communities all have different needs. So what we know are concerns in the African community will not be the same in the Asian community. So we're going to make sure that each vaccine education program is very tailored to the needs of their community. We're really excited about this.
This is some innovative work that we're going to use here in our vaccine education, but we hope it's work that we can carry forward and continue way beyond the pandemic. So good work out of you, Nola.
Thank you. Thank you. Very passionate about it. So when we look at the pandemic overall, we've been in this work since, well, really, we've been in this work since almost a year ago. What do you think are some of the biggest wins and some of the biggest challenges?
Huge wins, that medical coordination center, that is something that they had tried to get off of the ground for years here in Polk County, precedes my tenure as director here, and to see it come together and work so well. And the relationships that have been developed in that MCC are going to carry forward. They want to continue meeting and working together beyond the pandemic, and that just makes our community stronger. 211 is a huge win for us, and getting that as a central information hub is a huge win. Your ethnic-based community organization program, that is a huge win. We were really unique that early on, one of our partners in the Emergency Operations Center, EOC, I'm trying not to use too many acronyms here, was that we recognized early on that mental health was going to be a concern and an ongoing concern. I think it's going to be probably our next epidemic because we have high rates of depression and anxiety. But we brought in Polk County Health Services and immediately started threading in the focus not just on physical health, but on mental health. Really, I'd say all the partners that we brought into the EOC. We've had community family youth services from Polk County in here and working closely with our homeless shelters. I knock on wood that we have not had a significant outbreak of COVID yet in our shelters. We had an outbreak in a small shelter, but able to get it contained very quickly. The ability to have, first of all, a center out at the Iowa State Fairgrounds where we could safely allow people that were experiencing homelessness to recover from COVID in a safe and friendly environment. We transitioned away from that model in July and into a hotel-based one, but I think that has really helped us keep that community safe. So off the top of my head, those are a few big wins. Can you think of some others, Nola?
I think those are a lot of great wins, and I just really think the partnerships that we've really developed here in Polk County throughout this that we've never really had before, and I think we're really excited that those partnerships keep growing. It just shows this community really cares about its people and its residents, and they want to make our community safe and healthy. So I really think that's just something that I'm really looking forward to.
Yeah.
All right, so let's talk about this. What would you say to people who had maybe negative reactions? There's always negative reactions about isolation, quarantine, keeping my kids out of school and sports. What would you say to those individuals?
I hear you. COVID is not fun. And I think we're all experiencing COVID fatigue.
Mm-hmm.
I don't think anybody's any more tired of it than the health department staff and probably our health systems. I mean, it's really hard to stay focused on having to change your behavior for this long. So I would first say, I hear you, I empathize with you, but to come through this safely as a community, we have to think about more than just ourselves. We have to think about our neighbors, our friends, our loved ones, their loved ones, because the virus doesn't discriminate and the virus doesn't care. The virus is going to do what the virus is going to do, which is anytime we gather in groups, anytime we don't use our mitigation techniques of masking and social distancing, washing our hands, staying home with our sick, anytime we let our guard down, the virus takes advantage of that. And I know it's hard, and it's been really hard on parents and kids. I mean, trying to do schooling through home and through computers and all that, but know that we're here to support you. And if we can come together, then we have a chance of beating this thing. And vaccines are now becoming available. We will put this behind us, but we have to still, even while we're vaccinated, do all of those same old things. I personally have gone to, making it a little fun. My staff here at the office know that I color coordinate my masks. I wear goofy ones sometimes. You can have a little fun. Today's flavor is my cosmic kitty cat. I wear that. It's hard. It's hard for all of us, but we have to, I guess, have a sense of sacrifice. And I don't want to wag my finger at people about this, although my grandmother would be proud if I went like this. I don't think finger wagging helps. I think we have to constantly reinforce a positive message and try to appeal to that sense of community and community togetherness and community commitment, because the virus doesn't care. The virus is going to do its thing.
You bring up a really good point about COVID fatigue. How do you handle the stress? Your staff handle the stress? How do you keep your staff motivated during all of this?
I believe laughter is a really, really good thing, and it's very healing. If you tune into some of our meetings, sometimes you'll find out I bring in my little portable speaker and I'll play music and we'll dance at the beginning. We dance, we laugh at the boys dancing. Sorry, they're pretty bad sometimes. We laugh. I try to bring some treats in. We try to communicate and share. Personally, I ride my bike a lot. No, today it's a blizzard. I'm not riding my bike in a blizzard, but I do ride my bike a lot. I do yoga. I think really for everyone in our community, we have put out messaging. We need to remind people that self-care is important. Having a routine is important. Getting your sleep, getting your good nutrition, taking a break from the Zoom, having a hobby, reading a book, doing some things that are good for you and good for your soul are really helpful. But we get pretty silly around here sometimes. That helps.
That we do. All right. So the vaccine is here. What are some of the benefits and the challenges that you have already gone through with the rollout to the community?
Oh, yes. Right now, vaccine supply is extremely limited. So we have greater demand than we have supply. And we are only able to give vaccinations to members of the community that qualify in different phases. And I think sometimes that's hard for people to understand. And as a public health expert and professional, we believe in vaccines. We want everybody to be vaccinated. We want everyone to be vaccinated quickly if they're willing to get it. And having to wait is hard. So we're asking people for patience on this. So there's that aspect of it, but we also know that we have vaccine hesitancy in our community, and we have some myths and rumors that we need to, I think, help dispel and tell the truth. I talk a lot about the vaccine is safe. The vaccine is effective. No steps were skipped. No safety corners were cut to bring this to us. It is safe and it is effective, and people should get it when they have an opportunity. I want everyone to hear us loud and clear that for us to start to move to some kind of new normal, we need to have 70% or more of our community having significant immunity. So community immunity, I don't like the word herd immunity, community immunity to COVID before we can start really safely returning to a more normal way of life. And so I want people to know that until we reach that level, we're going to still be needing to wear our masks. We're still going to need to social distance and all of those things. I think there's a belief out there, I get the shot, then I'm good. No, you have to get one shot, then you got to wait 3 or 4 weeks and you get the second shot, at least with the dose of the vaccine we have now. And then it takes another 2 weeks after that for you to get immunity. We know it's 95% effective, the vaccines are that we have right now, but you don't know if you fall in that 5% where it doesn't work for you. We also know that the vaccine prevents the development of severe symptoms and disease. So we know it helps keep you from getting really sick. What we don't know is if it reduces your viral load enough yet that you don't transmit that and share that with someone else. They're studying that. I anticipate, as we move through this, we'll learn more, and those recommendations could change. But right now, it's get your shot and then still wear your mask until we get enough people vaccinated.
Is there light at the end of the tunnel with this pandemic?
Oh, yes, there is light at the end of the tunnel. There is light at the end of the tunnel, and I can see it, and the health department can see it. And we're working hard and furiously now. It's an interesting time. I mean, we have a focus on vaccinations, but we still have to do all the other work that we're doing. We're still supporting those health systems. We're still trying to make sure that our health systems won't be overwhelmed. It's really a race against time. We're very concerned about a surge here, February, March. It's post-holidays. This is weather that the virus likes. It likes cold, dry air to transmit. And we were hoping we can get through this, and then we'll be past what could be the worst season. We'll have more vaccine available, more vaccine in arms. I'm really hoping that, in the second half of the year that, we can be somewhat back to normal. And if you want it back to normal, when you get the chance, get the vaccine. That's how we get there. That really is going to be an important tool in how we get there. And then I don't know what I'll do. I think I'll go sit on a beach in the sun for 2 weeks.
Yeah. Final question for you. How has the pandemic changed the future of public health?
Public health, when times are good, we are really kind of like that silent partner in the back working on big world problems like, maternal health, sexually transmitted infections. I say we're out there saving the world every day, just very quietly, and nobody knows it. But this pandemic has put public health and public health professionals like yourself, Nola, front and center. You're a known face. You're a known commodity in the community. That means you have to behave. But I think it's really. I think that it has increased the interest in public health as a profession. I think there are a lot of health professionals that are interested in adding a public health degree in that background and kind of perspective, whether they're a pharmacist or whether they are a physician, a nurse. We see that. I do also hope that the important role that public health has played in this pandemic and really taking the lead is that funding begins to be restored to public health. We have seen consistent, significant cuts to public health funding for years, and that has cut down on the public health workforce and the work that we can accomplish. So I'm hoping coming out of this, we learn and we strengthen our public health system here in the United States.
Well, thank you. This has been a really candid conversation about where we are and where we're going in this pandemic.
Well, I have a couple questions for you, Nola.
Okay, let's go.
All right, let's go. Well, this has been one of the key components of what we've needed to do in this pandemic is communicate with our public. What has been your biggest communication challenge?
I think a lot of the communication challenge is just knowing and understanding about this disease. I think that there is so much miscommunication that we look to anything and everything, and what we see on the internet is what we believe. And I think really challenging people to find trusted and accurate information and to really look at the leaders who are providing that information. Because just because what I read on the internet does not mean it's true. So really working with our community partners in our healthcare fields to really get a unified message together and keep repeating that message so the community can hear it.
One of the things that I would count as a big win in all of this too, when you've been doing this for a year, it's easy to forget, but was your creation of the Polk County Health Department webpage and the COVID resources page, and positioning that as really that trusted source in our community and driving people to that to get the right information about COVID. I think that was important.
Thank you. I think that was really important. Just one universal voice where people could get the most up-to-date information about what was going on with the virus and now what's going on with the vaccine and with COVID-19. I think that's going to be incredibly important as we continue through the phases of the vaccine, where people know that they can go to the website and they're going to get the most up-to-date information.
One of the things that you led for us in this pandemic was a joint information center called a lingo again, a JIC.
A JIC.
A JIC. Can you tell the viewers a little bit about what a JIC is and how it operated for us during the pandemic, or is operating for us, because it's still in place?
Still definitely in place. So I knew from the very beginning with this that it was going to be really pivotal to have all of our health partners, so all of the hospitals and clinics in Polk County, working together to have one universal voice with messaging. And so I rounded up all of our hospital and clinic communication staff and asked them, hey, let's start a joint information center where we really work together as a team to make sure the messages that are coming to our community or coming from us to the community are very unified. And we really continue to do that. So a lot of the joint information comes from me, but it's coming from all of us. We're working together on a press release. We're working together on messaging. We've had town halls with the media to really work as a team to make sure that our community understands that they are getting one clear message. And that's so incredibly important because, as Helen said earlier, we're all in health, we're all competing in some way, but when you're in a pandemic, you have to work together as a team. And so we've done that, and we've continued to do this, and it's great because we bounce ideas off each other, we work together as a team, and that communication is really unified.
So I'm going to put you on the spot here. My last question for you, because you've heard them all. What is your favorite or craziest rumor that you've heard during the pandemic?
Right now, that you will get the vaccine and there will be a microchip put in you. I love that one. That you will get a chip put in you, or that your DNA is completely changing.
Okay. And how do you combat that kind of a message?
I think we really talk about the basics of what a vaccine is. And so I think you really look to say, well, this is what goes into a vaccine, and you kind of list that through the process and talk about how that the vaccine is reviewed through very scientific studies. It has to go through 3 phases. It has to go through 3 trials. It has to go through the CDC, the FDA, and we know for a fact that our community, our health partners, our medical partners would never allow for such a thing like that. And just really understanding that people have very different ideas and understanding, and how you really look at those different barriers to provide the most accurate information, but it's very scientific based, so they understand that kind of where that's coming from.
Well, you've handled all of those crazy questions with grace and intelligence, Nola, and we're lucky to have you.
I appreciate it. Well, we really thank DMU for allowing us this opportunity to share a little insight on what we have experienced so far in the pandemic. We really thank our community for continuing to support us during this time. And we really thank you all for your patience and understanding where we are with the phases in the vaccine. And you can always come to our website, polkcountyiowa.gov/health. We're on Facebook, we're on Twitter, we're on Instagram. Please check us out. We always try to provide the most up-to-date information on what's going on with COVID-19 and the vaccine. So we thank you for taking a little time out of your day to listen to Helen and I share a little of our insight on COVID-19.
Please be safe and be healthy.